Ambulance emergency. Tell me exactly what's happened.
He's vomiting everywhere.
From call taker
He's not even moving, he's just on the floor.
You're doing really, really well. We've got lots of help on the way.
to paramedic.
I'm just thinking, is this happening? Like, is this actually happening? Can't wait.
Tonight,
It's a 63-year-old male experiencing chest pain at Sydney Airport at the domestic terminal.
it's Laura's first shift.
What else do you do for a chest pain?
It absolutely could be a life and death situation.
What language are we speaking? Mandarin?
Walking into a real job with a real patient is a whole different ballgame.
How bad is the pain now? We're not getting anywhere.
Then,
So she's had a fall.
She grabbed into the mouth. Now it's not breathing.
Cardiac arrest, not breathing, found on the floor, blood coming from the mouth.
a paramedic veteran faces the ultimate challenge.
What heart rate are we getting?
Continue CPR, everyone clear. Quickly check for a pulse.
You getting anything?
Unprecedented access from the control centre
I'm just having a baby. Pretty full on.
I wasn't expecting that.
to the paramedics on the front line,
So he's fallen from that height there.
racing to save lives. These are the stories behind the lights and sirens
That's what we live for, eh?
of New South Wales Ambulance.
This is going to be fun.
It's the beginning of the morning shift.
Ambulance emergency, what town or suburb?
What's your exact address there? What caused the fall?
So what I want you to do is just to squeeze her shoulder and call her name and tell me what she does.
Okay, are you with him now?
Just had a little bit of goon.
So do you want an ambulance?
At the control centre, trainee call takers and dispatchers are paired up with mentors.
Are you happy to stay with Mackenzie until the paramedics arrive?
The mentor listens to the same call and guides the trainee in real time.
Okay, I'm going to stay on the line with you, okay? I'm not going to leave you. We're going to get through this together, okay? Go unstable.
Close that map down. Close that map.
This one, just here?
Yep. And I go to the
8:33, your case has been cancelled. You're right to take it back to Liverpool.
You're doing really well.
Really? Yeah.
Trainee Ashley is being mentored by experienced call taker Jess.
Ambulance emergency, what town or suburb?
We're on the way. I'm just having a baby.
Okay, I'm going to organise an ambulance for you. I need you to stay in the one spot, so pull over into a safe place and then give me the address.
She's out, the baby's out.
Is the baby breathing and crying?
She's fine.
Yes, we're going to get it to you as quickly as possible, okay?
Without pulling the cord tight, put the baby in the mother's arms or on her belly and be sure the cord is not wrapped around the baby's neck. Okay, I'm staying on the phone with you until they get there, okay? Did you have a boy or a girl?
It's a little girl.
Oh, fantastic. Congratulations.
It's obviously not going in from us. It's trying to be.
That's a good sign. Congratulations again. That's all a bit exciting to be involved in the birth of your baby.
Pretty full on. How far away is the ambulance?
We're working on that. It's 5 minutes away. 5 minutes away. Every minute feels like forever when you're in these sorts of situations, but the best thing we can do at the moment is to keep a close watch of mum and baby.
Yeah, okay, we're pulling up behind us now.
Are they right with you now?
Yeah, there it is now.
Okay, I'll leave you with the paramedics. You did such a great job. Bye-bye.
Thank you.
I wasn't expecting that.
Yeah.
Isn't that funny? I spent 12 years out there, never delivered one. I got here my first week I had a baby.
Every single time you just always get goosebumps.
It is my first baby. Yes, very exciting. You did good. You did really good. Really, I'm impressed with you.
In the eastern suburbs, new graduate Laura is getting ready for her first day on the road as a trainee paramedic.
People keep asking me, you know, if I'm excited for my first shift as a paramedic. I don't even know what the emotion is, what the right thing to say is. I'm just thinking, is this happening? Like, is this actually happening?
Her mentor today is experienced paramedic Blake.
First day on road.
First day on road.
You'll be right, don't worry about it. It will be good. You familiar with the car?
Ish, yeah.
This is the phone that we use to phone the cardiac unit. Should we?
Laura spent the last 2.5 years working as a call taker.
You really can only go so far as a call taker. Not getting to find out what's happened with the patient, that's one of the really difficult aspects of the role. You don't get that closure. I love it, but it's time to take the next step.
We come to the back of the car. These are all our kits, okay? They're labelled.
The thing that I'm most worried about is the unknown. It's not knowing what's going to come and being able to deal with things as they happen. I am feeling petrified.
Ambulance emergency, what town or suburb, please?
In the bush, on the other side of the creek in the swamplands between the I'm not sure if she had a full packet last night or half a packet.
Of what, sir? Of heroin, okay. Ambulance emergency, tell me exactly what's happened.
A bloke was just going for a run. He smacked into me against like a bench, and his whole knee split open. Like we can see the bones and everything.
Ambulance emergency, what suburb are we coming to?
Hello, it's at Sydney Airport at the domestic terminal.
Okay, so tell me exactly what's happened.
It's a 63-year-old male. They're experiencing chest pain.
Okay.
We're going to go to chest pain at the airport. Pick that up. Go 423 on the 1C.
423 on the 1C at the airport.
Laura and Blake are the closest crew, only 10 minutes away. Chest pain is one of the most urgent call-outs a paramedic can get. A significant number of life-threatening conditions can cause chest pain. A fast response and diagnosis could save the patient's life.
When you're driving, especially licensed drivers, that door is your responsibility.
Okay.
You're going to say clear left or no.
Okay.
Strong and loud, do you know what I mean?
Yep.
I use this analogy with driving. You're the sheepdog and they're the sheep and you've got to push them where you're going.
Yep.
You know? So clear left.
Yep, clear left.
And we'll head out the airport.
My first job being lights and siren to a chest pain, it's very scary.
It could be anything from cardiac-related chest pain. He could have a pulmonary embolism.
Obviously within my scope, I'm only allowed to give aspirin. What else do you do for a chest pain?
GTN.
Probably GTN. So I'm imagining the person on the other end of the phone and being asked all of those protocol questions, which I've asked 5,000 times before.
Is she completely alert?
I'm unsure.
Okay.
And all of a sudden, I'm going to a job that I've spoken to people on the phone about, but this is completely different.
Yeah, we are.
We're going to need the life pack,
Yep.
the fibre,
Yep.
and the green kit.
Okay. Chest pain, it absolutely could be a life and death situation. He could go into cardiac arrest. It's petrifying. But something that is so important in this job is having good communication skills. And as a call taker, that's something that I feel like I'm very, very good at. Hello. Do you know his name? His name? No? Okay, that's okay. Hi. My name's Laura. On a scale of 1 to 10, if 10 is the worst pain you've ever had, what number?
The patient can't speak or understand English.
Okay. It's a very scary thing, no English, and you're trying to work out what's going on with people. In this job, a mistake could be life or death. On a scale of 1 to 10, if 10 is the worst pain you've ever had, what number?
It's Laura's very first call-out as a trainee paramedic.
Okay.
The patient has chest pain and can't speak or understand English.
What language are we speaking? Mandarin?
To go from call taking to a very new level 1 paramedic, it's super, super overwhelming. You've got that big responsibility of treating their pain, and the stakes are so much higher in this job. Okay.
With no interpreter available, Laura decides to try a translation app.
Yes, I do.
Yeah.
Okay.
Speaking.
When did the pain start?
This morning. Yeah.
Okay.
6.
Yeah? Okay. All right. How bad is the pain now?
Let's go a different way.
Yeah, we're not getting anywhere.
No, it's fine. Let me just jump in here.
All right.
So,
I'm just going to take his blood pressure. Okay. Has he ever had aspirin before?
Every day about 100.
100 milligrams. Blake, I'm going to give him 300 milligrams of aspirin. You happy with that? There are no dumb questions. Because you're having the chest pain, I'm going to give you 300 milligrams. With anything clinical, you can't get tied up in, should I, shouldn't I ask this? So put it in your mouth. Because if you don't, that could be the difference between someone getting better or making someone really sick. Good job. Can you sit forward for me? Sit forward for me.
Are you flying in or are they?
They're flying to Melbourne just for holiday.
Okay, that's all right. I'm just
But
trying
they said they already missed about 2 flights.
to. I'll do the 12 where you set up before.
Sure.
Just stay still. Just relax.
Time is critical, so they use an ECG to see if there's something wrong with his
So
heart.
sinus rhythm, possible right ventricular. So at his age, it's quite possible that he has a pre-existing cardiac condition.
The result shows the patient is at risk of a heart attack and needs to be taken to hospital immediately.
English. Are you coming to hospital with us? Yeah? See?
We did a lot of practice on mannequins, but walking into a real job with a real patient is a whole different ballgame.
Thank you, Sissy.
Oh, that's okay.
Don't be afraid to clear people. So don't be afraid to clear people out of the way because he's got chest pain. Which way are we going? This way? It's all right. You'll be good. Okay? Stay in the back. Stay with your patient. Thanks, mate. Stay with your patient. How's his ECG looking and how's his pain?
It's normal, pain's the same.
Are you happy for me to move?
Yeah, I'm good.
I'm the paramedic now, and I have to keep pinching myself. I can't believe that I'm doing it. It's huge. It's massive.
So just run through a checklist in your mind of what's done, what you've got to do, you know?
His stats are back up at 99. Pulse is still 80.
How's our pain?
Stats are good. Blood pressure has gone down, but the pain's the same.
Go out the side way. That's all good. There he is. He's good, isn't he?
It's nice to know that I'm on that other side now, and I can't imagine going and doing a normal job after this. I don't think I could do it.
Laura, how do you feel? How do you think that went?
Yeah, it was full on, and obviously we did kind of like a brief in the car on the way up, and you were like, these are the questions you need to ask. So I was going through that in my head, and then we got there, and I asked the first question, and then I realised you couldn't speak English, and I was like, okay, well, I'm done.
I think you did well. That's a pretty nerve-wracking first job in public at the airport.
Yeah, thank you.
No worries.
It's close to noon at the control centre and call takers are answering an emergency call every 27 seconds.
Ambulance emergency, tell me exactly what's happened.
I don't know, he swallowed it and he stuck on his throat.
What did he swallow?
His teeth.
It's like fake teeth.
Yeah, full.
Not every call requires an ambulance. Learning which ones are priorities is a big part of the job.
Okay, tell me exactly what happened.
No, you drink something.
Can you tell me what's happened?
My son, he drinks drugs or anything.
He's drank too much?
Yeah, I got a drink for that. You take something.
Yes. So has he had alcohol or drugs?
I don't know. So now, okay, I got down, but now you can take it for you.
You know what? You just take it as it comes. You never know what's going to be on the other end. So once you answer that phone, that's what you've got.
Ambulance emergency, tell me exactly what's happened.
There's a man just taking his clothes off, running out in front of the traffic. Now actually laying down on the ground. Yeah.
All right.
He might need some assistance.
Is he awake?
Yeah.
Is he breathing?
Yeah.
I feel like you take a lot of calls on a daily basis, generally of the same nature.
God bless some person just trying to get him a jacket.
Bless. Thanks for your help. Bye. It's kind of hard not to laugh at those kind of things because you get a bit of a visual in your head of some man running around naked in the middle of the street.
It's going to be one of those days. The way that my morning has started, it's going to be one of those days. We can roll with it.
Ambulance emergency. Tell me exactly what's happened.
It was at a formal yard. Had a call probably of 3-4 metres.
Is there any serious bleeding?
He's got a gash to the back of his head.
So we just don't want him moved unless it's absolutely necessary. Just tell him to be nice and still there and wait for help to arrive.
Sydney calling Inspector 34.
Inspector 34, Sydney.
We had a call for someone who's fallen at a construction work site. The patient's fallen approximately 4 metres.
Okay, no problem at all. I'll advise. We're not far off location. So it's a guy falling off some scaffolding or something.
Each year in Australia, approximately 25,000 falls occur in the workplace, resulting in serious injury. 3 emergency vehicles are converging to the building site in Sydney's west. 2 ambulances, including an intensive care paramedic, are coming from the east, while Duty Operations Manager Brian is driving from the west, 9 minutes away.
Oh, mate. That's where I wanted to go, dude.
Well, he's the hardest working person in the ambulance service of New South Wales. And the smartest one too.
I've been in the job 28 years. For me, after being exposed to so many different types of incidents over the 28 years, having that sixth sense about what's going to happen or how something's going to play out potentially may save your life.
Seriously, come on, people.
What I do know, experience has told me that time and time again, patients who have fallen from height, generally, there's got to be consequence from it.
Inspector 34 is on scene now.
A bit of grab a heart out, I reckon. Where are we going, guys? Hello. Yeah. How many stories?
It's the same couple, because you go up, it's still a construction office.
Yeah.
Intensive care paramedics are already treating the patient on one of the upper floors, but the full extent of his injuries is unknown.
Yeah, you there, Brian?
Yeah, mate, we're just making our way up to you now. We've got a Stokes, spine board and some straps. You need anything else?
We're priorities. Call on spine board first, Stokes second.
Yeah, roger, mate. Just give us 5, we'll be up with you. Who's the supervisor? Oh, I need to show us the way up.
We know statistically for people that fall from heights of greater than 3 metres generally end up with a significant injury. And in most cases, the obvious injury may not be the most life-threatening. So we just have to minimise the on-scene time.
I'll go up there, you can pass that to me if you want.
Is this the only way out? Wow. I mean, this is going to be fun.
straps. All right.
What we're going to do, we've got this big plastic board that we're going to pick up. Sensibility. So if the pain gets too much, we just let it.
So he's fallen from that height there, Andrew?
Yeah, just through that.
Is his pelvic symmetry normal?
It is normal.
The main issue is obviously he's hit his head.
The patient has sustained an injury to the back of his head. The risk of spinal trauma is also high. They need to get him to hospital as quickly as possible.
Okay, whenever you're ready. Everyone ready?
Some injuries you can't detect. Do they have brain swelling? Have they got an intracerebral bleed? We can't see. They're the things that we can't, as paramedics, detect.
How you going, mate? We're going to get you out of here shortly, okay? What's the best way out? Same way we come in, or...?
We find people in some of the weirdest places to get them out. And depending on the level of trauma, every second that ticks by can literally mean the difference between life and death.
Can we come out there? Nah. Mate, are you serious?
Getting the patient out on a stretcher the same way they came in is impossible. Brian needs to work out how to get him down to the ambulance.
It's looking pretty nasty, isn't it? Look how narrow it is. What's the best way out? Same way we come in, or...?
At a construction site, Duty Operations Manager Brian is treating a patient who's fallen from a height and injured the back of his head. There's risk of brain damage, so they have to get him to hospital. But carrying the patient down to the ambulance is proving to be impossible.
Can we come out there? Nah. Look how narrow it is.
I guess one of the things about being a paramedic, sometimes you've got to just be inventive, work for that solution. And when you find the solution, it does work.
So what I was thinking, we'll put the stakes here, and then we'll lift him up and then load him in there, put him in the pill box from the crane. Yeah, I think it's probably going to be the best way to extricate him.
Brian decides the safest way to get the patient down is with a crane cage. But there aren't enough paramedics to carry him out of the tight space he's fallen into. They'll need help to put him in the cage.
What we do need, though, we just need some guys just to get us across from here to the cage. Yep. Guys, what we'll do is we'll pull him out and then we'll hand him to you. So rather than a lot of people moving, okay? So just, guys, everyone be aware. See where this guy's standing here? Don't knock him, because he'll fall down that hole. All right, you guys right? How about we just slide first?
Elbows in.
Yeah, that's all right. We're going to go to another beam. Okay. So pass them up to these guys and just hand over hand, use our carry.
Handles on the side, guys.
Support the weight, guys, and we lower him down together. It's going to be easy going across here.
Julie there, mate. Julie there. Let's
Drop him down this end. All right, that was tighter than it needed to be.
Being a paramedic is about having experience. One of the things you'll learn after being a paramedic, as long as I have, is that you need to have a little bit of MacGyver about you to be able to overcome a problem.
Might get a little bump here, so you're coming down nice and down.
You don't find that in a textbook. That is just paramedics thinking outside the box.
Prepare to lift, lift. Hold it up. Prepare to lower, lower. That's a nice way down. Better than walking down, eh? It's a good means of extrication. That's the best way. It's like a magic carpet ride.
To be working in such a highly focused team, irrespective of where you work, is very rewarding. We all have a common focus, and that's to provide care to the patient. That's what makes the job.
All right, mate. You're in the best of hands, okay, buddy?
He did have a long fall, but the patient's quite stable. He's being loaded up into the ambulance and being transported as we speak.
Our work here is done. All right.
Okay, listen. Stop yelling, okay? If she's having trouble breathing, yelling's not going to help, okay? So tell her to calm down.
It's mid-afternoon and the control centre is dealing with a sudden influx of calls.
Is there any serious bleeding?
Bleeding, too much bleeding, please help me.
Ma'am, you need to just keep the pressure on his head. That is what you need to do.
You need to be calm.
Ma'am, you need to remain calm. You yelling is going to make him more upset.
Over a 12-hour shift, a single call taker can answer more than 70 calls.
Victoria, don't worry about that. We're going to move past that.
They are screamed at, verbally abused, or threatened by almost 10% of callers.
Okay, don't swear at me. Listen to me. I'm organising help for you now.
How many times you ask?
Don't get angry at me. I'm just making sure we're sending the ambulance to the right place.
The last 3 people I've taken calls from have yelled at me, we need an ambulance now. As the day just gets on, everyone's just getting a little more anxious and a little bit more worked up.
Oh, gosh. I can't deal with it this afternoon. He just started yelling at me straight away.
I was at Centrelink before I was here, so still a call centre. It's different. Like the ones at Centrelink, they're abusive because they're angry. But usually here they're more abusive because they're scared or they're frightened.
You just deal with it. That's what that's what you're going to be getting.
There's the good things as well, and if you can make a difference, I guess that's why I do the job. I want to make a difference, so that's what keeps me coming back.
Ambulance emergency. Tell me exactly what's happened. I've had an alarm activation.
Is that the alarm company?
Yep. I've tried to call the client on the phone with no voice contact, but I've managed to hear the client. She's calling, please help me. You can hear her? Yes, she just keeps saying, please help me. It sounds like she's a bit short of breath there. I'm not too sure what's going on there. Alrighty. She just keeps saying, please help me, please help me.
Okay, so I've got a car on the way to come out and help you.
423 Sydney. So we're going to an alarm.
Patient is calling for help, sounds short of breath.
City 4, 657, 657.
Laura and Blake are the closest ambulance, 8 minutes away.
This is a 90-year-old female. She's activated her medical alarm, but we haven't had any voice contact with the patient. I know from cohort that there's a lot of accidental activations. Having said that, though, it says in the notes that she's calling out for help, so I would say it's potential for her having had a fall and not being able to get to the phone.
In Australia, 1 out of 7 people is aged 65 or older.
Clear left.
They might also be an invalid, bedridden or wheelchair bound. You don't know.
Yeah.
So
for sure.
We've got to take these things on board and think of all the possibilities.
More than 720,000 elderly Australians have received home support services of some kind in the past year.
We will take all the equipment with us. We'll take the 3 main kits.
Life pack and the drugs.
That's correct.
Yep. The thing that I'm most worried about is the unknown. It's not knowing what's going to come. It's the ambulance! And being able to deal with things as they happen. Hello.
Why are you here? Why have you come?
We had a call from your alarm company. Do you have pain? You saw anywhere?
No.
And what about your breathing? Can you breathe okay?
I'm breathing okay.
Yeah, good.
But not perfect.
What about your heart?
We'll do a quick assessment,
Yep.
do some basic
Yep.
blood pressure. Your ECG, we'll do a 12 lead. So let's see what this one pops out. She's got some ECG changes. Right bundle branch block, and this one here, it's MI at the bottom there.
Yep. Is she on cardiac meds? I didn't see anything.
Have you ever had a heart attack before?
No. Our machine is telling us there might be something wrong with your heart.
The ECG shows a blockage in her heart. The patient needs urgent care to prevent a heart attack.
We're going to have to take you to hospital.
No.
I know.
No. My cat.
Your cat, I know.
I have my cat
You
to
need-
look after.
You need to come to hospital.
No. No.
Okay, okay, it's all right.
No. Please. I love my cat more than myself.
Cat's going to be all right.
We're worried if we leave you here.
So she's not really capable of making a responsible decision about her own health.
Blake calls Duty Operations Manager Paul to come and assist.
Inspector 66.
Yeah, g'day mate, how are you? Look, we've got a lady, she's in her 90s, she's got some ECG changes. I really want to take her to hospital because of the changes, but they're refusing. You can probably hear the anxiety going on in the background. She's very hard to control. So I'll see you when you get here.
Copy that, no problem, thanks.
The inspector is now on his way.
Okay, cool. Blake's gonna get the bed and we're going to take you to the ambulance. Do you understand?
No.
Yes.
No.
It's okay. It's all right.
It's our responsibility to extract that patient. It's someone's mum, it's someone's dad, it's someone's sister, it's someone's important to someone else.
Please don't be upset.
Hello there, how are you? My name's Paul, and we're here to help. I have to take you to hospital. I know that you understand what I'm saying. Your oxygen levels are too low.
I don't care if I die.
I care. The law actually says that you have to look after you. Let's put your bed in terror. And we're doing what here. Your oxygen levels are too low.
I don't care if I die.
I care.
Laura, Blake and Duty Operations Manager Paul need to take an elderly patient to hospital. They suspect she might be having a heart attack. But she refuses to leave her house.
Blake's going to bring the bed into here, and we're going to help you because we have to.
Just try and relax. Try and relax.
Can I ask you something?
I'm just going to help you put your legs up. Hang on.
Can you open its head for the cat?
We will feed the cat now before we go. I will. She'll be okay. We know she's very important. She'll be okay. Just try and calm down. Just take a deep breath.
And Laura's in the back with you, okay? You're going to be fine.
Yep.
So we've got our prints.
One of your concerns was the one of them came up as a STEMI.
Yeah, you're right, I know. I just then the anxiety's going to go again. It's going to give you some oxygen,
Listen,
okay?
I'm just going to put these are going to go in your nose, okay? It won't hurt. Just going to give you a bit of oxygen.
You want to kill me.
It's okay.
He wants to kill me.
Her anxieties are based on the fact that she spent a year in hospital. And she doesn't want to go back to hospital. She wants to stay at home. She wants to be, in home as much as possible. And it saddens me to have to do this to patients.
I understand.
These traumatic experiences, it's very important to keep the patient calm. If the patient's not calm, we can't do our job properly.
It's okay. I'm just going to put this on your arm. It's not going to hurt. I just need to put it on your arm, okay? Having been a patient myself, I know how scary, how overwhelming it can be.
I am a human being like you.
I know, and listen, I know it's really difficult to understand at the moment, but we're doing the best thing for you. If we came to your house and we didn't take you to hospital and something happened to you after we left, then we haven't done our job. We're here to help you, okay? I know you're very upset. We left food out for your cat, okay? She is gonna be okay, and you will be back. Some people will cry, some people will yell and swear and get angry. You need to recognise the difference between somebody who's just scared and upset and is reacting in that way because of that, and someone who is actually, out to abuse you.
Can you understand how much I love my cat?
I know.
Can you understand how I feel?
I can. I can, and I know you're very worried about your cat, but we're very worried about your health. It definitely takes a certain type of person to do this job. You could be the best clinician, you could be a doctor, but if you can't empathise with your patient, then you can't do this job. We have to get the tests. All right? Okay? I know, you're doing really well. Just try and relax, okay? Just sit back and relax.
Laura, you good to go?
Yeah. If you go to the job and you're nice to them, you make that little bit of effort to, you know, feed the cat or put the baby to sleep, then you're doing your job.
Day one.
Day one. Graduated yesterday. Thank you.
It was intense. It was really intense. I've never dealt with somebody who doesn't want us before. Normally, I'm hearing people that are like, hurry up, get here, we need you now. That's really new territory for me.
How are you feeling mentally? Because that can be very mentally draining.
Yeah, it was definitely tiring.
But I thought you handled it very well.
Thanks.
Yeah, well, you did.
At the end of the day, she got to where she needed to be, so...
She definitely needed to go to hospital.
Yeah. It's hard to know where the line is, like when you kind of just have to put your foot down.
You'll get there.
Yeah.
We all do.
If it wasn't for you, I'd still be there feeding a cat.
Yeah, well, there you go. You know?
So, it really is overwhelming. You need to be able to take a step back and remember that, you know, you've done your job and everyone was a trainee once. That's something that you really need to remember.
Look at that water out there. It is beautiful out there. Look at that.
I like this time of the year. I like, you feel refreshed, you know what I mean?
Yeah. I've been a paramedic for 32 years now. When I started in 1986, women weren't particularly welcomed.
You're looking really professional right now.
Mm-hmm. You certainly didn't go and do a man's job. People said I couldn't do it. So I have had to prove a lot of people wrong over the years. This shirt, I've grabbed the wrong shirt out. See, it's got a little buttonhole that's just a little bit too big for the button. Well, you have to be my mate and tell me if it comes undone.
Sure, I'll tell you as soon as I know this.
I did an entire code 9 with that button undone.
You're trying to get a promotion or something?
Shut up. You smart ass.
Ambulance emergency, what town or suburb? Darlinghurst. There's someone here that's dislocated their knee. He's in a lot of pain. Okay.
I'm a partner. He has MDMA and cocaine. Vodka and Red Bull. He's going a different colour now. He's going pale.
The ambulance is on the way, okay?
Yep.
Ambulance
emergency, what town or suburb, please? Tell me exactly what happened.
I come to notice. She's my client. When I come, she on the floor and she's bleeding.
So she's had a fall?
She's bleeding right in the mouth.
Is she breathing?
No, it's not breathing. Did ambulance come? Ambulance come?
The ambulance is coming as quickly as it can, ma'am.
It's 35 on the way to that Peakhurst, please.
It's a 1A.
All right, 45 going to 1A.
Life-threatening emergencies like a patient not breathing require an intensive care paramedic. Edward and Carolyn are 7 minutes away. They will rendezvous on scene with another ambulance that's closer to Peakhurst.
90-year-old, it's not breathing, found on the floor, blood coming from the mouth. What are we up to? Okay, patient located in the back of the property. Peakhurst, I know exactly where that is. It's around the corner from my mum's house.
The first paramedics have arrived and send their report.
A 90-year-old female who's unconscious, not breathing, and it's a confirmed cardiac arrest.
This patient is actually in cardiac arrest?
Yeah, you do the airway, I'll do the other stuff.
The patient has been down for almost 8 minutes with no heartbeat. They need to start CPR immediately.
Oh dear.
It's always the way.
Whoa.
Stop. okay with the shoes. Don't get out of the way.
Just here. When they're extremely unwell and potentially dying,
Turn right.
you have to try and lessen the impact.
So keep going up that way. It's going to be
We're
right up
fixers. We go in and we fix as best we can, and it's instantaneous. You make a difference to people immediately. We go into people's houses. They call us when they're at their lowest. And if we don't get them to the hospital alive, then there is no other care.
Hey guys.
Hey guys.
Excuse me. Hi, how are you? Right.
Edward and Carolyn are on scene with a 90-year-old patient who suffered a cardiac arrest.
Was apparently found collapsed just in the garden there by the cleaners. Apparently she was alert at that time, but then apparently she's had about 10 minutes of downtime.
No CPR?
No CPR in progress before our arrival, no. So we've just done one cycle now with asystole.
What are we in?
One side, got systole.
Yep.
IV access?
I've got it.
Okay.
She's had no heartbeat for approximately 10 minutes.
We're running asystole protocol.
With every minute, her chances of survival drop dramatically, so they need to get her heart beating again as soon as possible.
Counting in for the ventilations. All right.
5, 4, 3, 1. Okay, that was at 4:20. So
can you set me out with a 7?
Do you need a bougie?
No.
If they can get a rhythm, they can use a defibrillator to shock her heart back into action.
All right, everyone clear, oxygen away, stop CPR, check for the rhythm. Confirm that's not a shockable rhythm. Please dump that shock.
The flat line means there's no heart rhythm, so they can't shock the heart.
Back to CPR.
They start the CPR cycle again.
So we run this for 20 minutes, and we'll see how we go from there, okay?
Good. There we go. Even after all of these years, a cardiac arrest, it's still the job that gives me sweaty palms.
Are you good there?
To save that person's life, it's a very big responsibility.
Okay, adrenaline, 1 in 10,000, 219.
Stop CPR. Oxygen away. That's a not shockable rhythm. Can we please stop that shock? Back to CPR, please. Print.
Right.
Yeah, thank you.
When I was young, my best friend's mother was taken away in an ambulance, and it was the last time she ever saw her. She never, ever really got a chance to say goodbye, and I always remember that.
Yes, ready to go.
There's nothing you want more than to get that patient back to their family.
So 4 minutes.
Okay, hold on, stop CPR. Yep. Guys, no shockable rhythm, everyone clear, dump the shock. Dump it, dump the shock.
To maximise their efforts to restart the heart, they also inject her with adrenaline.
Please, thank you.
They top up the adrenaline every few minutes.
10:18.
Fantastic.
The paramedics have been doing CPR for 12 minutes.
Next adrenaline's ready.
Swap again, yeah. Get ready to go, come on. Fantastic, well done.
Okay.
The dog
What
that's on the
size?
14.
You getting anything? What are her pupils doing? Fixed and dilated.
Stop CPR. That's a no shockable rhythm. Please cancel the shock. That could have a print. I could have a pulse. Let's quickly check for a pulse.
There's fluid coming up.
I had a pulse on that one. All right, let's start to set the traction. Fantastic.
The patient has a pulse and they can stop CPR. But her condition is critical and she needs to get to hospital urgently.
I want to keep moving now because she's gonna make it. We need to keep moving.
The damage to her heart is unknown and her life is still at risk.
There's information on board. We get central traffic code 3, please.
45 on 80. Okay, she's sitting at 86. What heart rate are we getting on there?
60.
Right, that's good. So it's all marrying up.
2.2 milligrams of adrenaline will be there in 5 minutes.
Yeah. What are those pupils doing?
They are a bit better. They are reactive. They are about 5 mils now.
Just cannulating, Pete.
All right.
You got a pulse?
Front 2, front 1. Once we stop the car, we get a nice clear too early. All right. We stop now?
Let me get this on. Get.
Okay. Excellent. All right.
Just 1 sec, mate. We're getting the 12.
They get the patient to hospital in a critical but stable condition.
Right, are you good here? When you're actually doing the job, when you're actually trying to get the best outcome for your patient, you're not thinking that what you're doing is heroic. You are too busy trying to save that person's life. And it's a good day if you do.
That's
That's
what we live for, eh?
Good job. You did a good job. That was good. And it's great for the family that they have their loved one back, or they get the opportunity to at least be able to say goodbye. And that in itself is huge.
She's reacting now. She has the people are constricted. She's breathing. Like how she goes in the next couple hours, no one knows. But it's the best case scenario for what we found.
There is no other job that really, for me, compares to being a paramedic. That ability to be able to make a difference, which is why I've stuck with it for such a long time. 32 years and counting. Do you want me to start?
I do the paperwork.
Do you want to do it?
I do it.
Do you want to do it?
While we do this.
It's part of the IC service.
Oh, shut up. Shut up.
Hi, just quickly, I just got a job, so don't think I'll be able to come to dinner.
So it's come down?
Yep.
Where are we going?
So vessel overturned. 4 people in the water. They're all now being retrieved. They've pulled the helicopter off and they're going to send patients by road. I have so much respect for everyone who works in any capacity in ambulance. I think it is one of the most important jobs that you could ever do. And it is a humbling thing to be part of that. Clear left. You're doing a really good job. I know it's a little bit stressful. Call takers, the dispatchers, the on-road guys, they all play such an important role.
We've got Officers Marshall and Marshall in 833.
I need you to remain calm so we can patch you up properly.
Someone somewhere needs an ambulance every 30 seconds in the day. And that's unbelievable.
We've got ambulances coming to you very quickly.
Why you look?
Jesus Christ.
Let's just give him some pain relief before we do anything.
1, 2, 3.
Oh, no. Are you ready for your siren, Betty?
Here comes Betty.
Oh, wow.
I absolutely think this will be my job for life. Once you're part of the ambulance family, you really don't look back. I'm really lucky.
They're coming. Lights and sirens for you, okay?